गुड। कैसे फिजियोलॉजी कॉन्फ्रेंस की तैयारियां ठीक जा रही हैं?
आप लोगों का सपोर्ट हमारे साथ है। बहुत अच्छी कॉन्फ्रेंस बनाएंगे और होपफुल कि इंशाल्लाह बहुत ही जाएगी।
अस्सलाम वालेकुम। अस्सलाम वालेकुम।
वालेकुम अस्सलाम वरहमतुल्लाह वबरकातुहू।
जी डॉक्टर मुबशिर कैसे हैं आप?
अल्लाह का करम सर, अल्हम्दुलिल्लाह।
आप भी आज हमारे दरमियान मौजूद हैं?
जी मैं सर सारी अटेंड करता हूँ आपकी।
अच्छा 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 अच्छा। आज हमारी यंगेस्ट बेटी बिल्कुल नौजवान टीचर आज मेडिकल एजुकेशन के इसके ऊपर दे रही है। तो
अस्सलाम वालेकुम।
जी वालेकुम।
अस्सलाम वालेकुम मुलाजिम साहब।
जी मैडम कैसी हैं आप? ठीक हैं?
अल्हम्दुलिल्लाह, आप सुनाइए।
एमडी कैट का टेस्ट हो रहा है हमारा। मैंने कहा मैं पहले इससे वो भुगत लूँ फिर उधर जाऊंगा।
बस अल्लाह पाक अच्छे डॉक्टर्स दे पाकिस्तान को और दुनिया को।
आमीन आमीन आमीन।
आमीन।
राशिद साहब आप कैसे हैं?
सर अल्लाह का शुक्र है। बस आपको पता है जूं जूं नजदीक आ रहा है टेंशन बढ़ती जा रही है, तो
हाँ
इंशाल्लाह ताला आप लोगों का तावन होगा।
अक्सर ये आपकी फिजियोलॉजी के लिए दुआएं बहुत ज्यादा हैं।
सर जज़ाकल्लाह, बहुत शुक्रिया।
मेरा सिंपोजियम हुआ ना तो वो आपके प्रेसिडेंट आए और फिजियोलॉजी का एक पूरा सेशन हुआ तो लोग
जी जी।
कहते हैं सर आप पैथोलॉजिस्ट हैं या फिजियोलॉजिस्ट हैं? मैं मैं पैथोफिजियोलॉजिस्ट हूँ।
सर आप बिल्कुल पैथोफिजियोलॉजिस्ट, आप जो है 100% पैथोफिजियोलॉजिस्ट हैं। ये किसी बात हो रही थी जब अभी स्टार्ट हुआ था, कुछ थोड़े से वो एब्स्ट्रैक्ट और स्प्लेनरी आए थे, तो हम कह रहे थे कि यार हर सूबे से एक एक आना चाहिए। तो किसी ने कहा आजाद कश्मीर से है, तो मैंने कहा है। कहते हैं कौन है? मैं मुलाजिम साहब। कहते हैं कि वो तो पैथोलॉजिस्ट है। तो मैंने कहा वो आपके लिए पैथोलॉजिस्ट है, हमारे लिए फिजियोलॉजिस्ट है। तो हमने जब काउंट कर रहे थे कि हर सूबे से कम एक होना चाहिए,
आना
तो
चाहिए
हमने कश्मीर से आपको काउंट किया हुआ।
आना चाहिए आना चाहिए। मैडम सलमा कैसी हैं आप? मैडम सलमा आप ठीक हैं?
हाँ जी अल्हम्दुलिल्लाह ठीक हूँ। ये गर्मी कुछ जाने का नाम नहीं ले रही।
अच्छा 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 अच्छा। तो वैसे इधर तो बेहतरी है मुजफ्फराबाद में।
बेहतर ये क्या कहूँ, यहाँ पे वो चिप चिप वाला है।
हाँ वही वाला इधर भी है। वही है इधर। सेम सेम वेदर होता है। जदून साहब ठीक हैं? अगर जदून साहब ठीक हैं?
हाँ उन बेचारी को बैक एक बहुत है, कोई पीछे उनका सिस्ट निकला हुआ है।
अल्लाह।
आप डॉक्टर्स कहते हैं इसकी सर्जरी होगी। ऊपर से पुलिस के रेडों ने तंग किया हुआ है। कुछ समझ नहीं आ रहा है, इलाज करें तो कैसे करें।
हाँ 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 बिल्कुल बिल्कुल बिल्कुल। ये मदिया को दे के आपने अच्छा किया। ये नौजवान टीचर्स जो है ना आने वाली हमारी नस्लों के वारिस तो यही है ना। अच्छे अच्छा अच्छा
नहीं
अच्छा।
ये हमारी माशाल्लाह मोमन में बहुत अच्छी डीएमई की फैकल्टी है एंड शी इज
हाँ,
पार्ट ऑफ डीएमई। ये
हाँ,
मास्टर्स करेंगे, इनका हो जाएगा सितंबर में इंशाल्लाह
मास्टर
ताला।
मास्टर मास्टर जी बिल्कुल। मास्टर भी करें और पीजी भी करें।
पाकिस्तान में डीएमई में पीएचडी का मुझे नहीं पता कहाँ हो रही
नहीं
है।
नहीं आपको आपको हम तेहरान यूनिवर्सिटी ऑफ मेडिकल साइंसेज ईरान यूनिवर्सिटी ऑफ मेडिकल साइंसेज से करा देते जहाँ रिकॉग्नाइज वर्ल्ड रिकॉग्नाइज करती है।
हाँ बिल्कुल बिल्कुल।
हाँ बिल्कुल। हमने रिटायरमेंट के बाद आपके मेडिकल कॉलेज पे ही तवज्जो देनी है।
इंशाल्लाह इंशाल्लाह ताला लजीज।
इंशाल्लाह इंशाल्लाह इंशाल्लाह। तो
13 लोग आ गए हैं। लेट्स सी कौन कौन आए हैं।
हाँ इसको मैडम मेरा ख्याल है कि मुझे 2 मिनट दें। 2-3 मिनट दें। इसके बाद
ओके डॉक्टर फातिमा आ गई हैं, रफीक खानानी साहब आ गए हैं, मुबशर साहब आ गए हैं,
ये हमारे परमानेंट
डॉक्टर
मेंबर हैं।
समी काजी, डॉक्टर राइमा।
ये हमारे परमानेंट मेंबर हैं। प्रोफेसर खानानी साहब अस्सलाम वालेकुम। प्रोफेसर कानानी साहब, अस्सलाम वालेकुम।
अच्छा, आजकल नेटवर्क का भी बड़ा मसला है, अक्सर आवाज नहीं जाती। मैं जिससे भी बात करूं फोन पे कहते हैं आवाज
अच्छा
नहीं आ रही।
अच्छा अच्छा अच्छा। डॉक्टर निगत भी आ गई हैं, पुरानी मेडिकल एजुकेशन एक्सपर्ट इन मेडिकल एजुकेशन। डॉक्टर निगत अक्सर अटेंड करती हैं। अच्छा, डॉक्टर मासूमा भी आई हुई हैं। तो टाइम हो गया मेरा ख्याल है। हाँ, हो गया। तो अब
11 बज के 2 मिनट।
इजाज़त दें तो शुरू करें इसको।
बिस्मिल्लाहिर्रहमानिर्रहीम। पूछेगा।
जी, औज़ु बिल्लाहि मिनश शैतानिर रजीम, बिस्मिल्लाहिर्रहमानिर्रहीम। I am honored to start the 82nd webinar. Before starting today's webinar, I will request Professor Rashid Saab to start with Holy Quran, recitation of Holy Quran. Professor Rashid Saab is a professor
sir.
of theology. Yes.
जज़ाकल्लाह। अऊज़ु बिल्लाहि मिनश शैतानिर रजीम। बिस्मिल्लाहिर रहमानिर रहीम। लक़द कान लकुम फ़ी रसूलिल्लाहि उस्वतुन हसनतुन लिमन कान यर्जुल्लाह वल यौमल आखिर व ज़करुल्लाह कसीरा। सदक़ल्लाहुल अज़ीम। तर्जुमा। इस सूरतुल अहज़ाब की आयत नंबर 21 है। हकीकत ये है कि तुम्हारे लिए रसूलुल्लाह की ज़ात में एक बेहतरीन नमूना है, हर उस शख्स के लिए जो अल्लाह से और यौम आखिरत से उम्मीद रखता हो और कसरत से अल्लाह का जिक्र करते हैं। और ये चीज़ हमारे लिए वाकई नमूना है। और रसूलुल्लाह सल्लल्लाहु अलैहि वसल्लम की ज़ात जो है वो बहसीयत टीचर भी हमारे लिए एक बहुत बड़ा नमूना है। सदक़ल्लाहुल अज़ीम।
Jazakallah. Thank you so much, Professor Rashid Saab. You are always with us since the start of this webinar systems. This webinar is in collaboration with the Women Medical College, Ahmedabad. Basically, when the Professor Salma Kundi was the president of the PMA, this idea was generated and we started this. So under this umbrella, so many other and our collaborative societies are there. Pakistan Physiological Societies, Pakistan Asian Physiological Society, Pakistan Association of Pathologists, and Azad Jammu Kashmir Medical College, Muzaffarabad. I am very happy that today's our speaker is our new generation, young generations, and DME, member of the DME of Women Medical College, Ahmedabad, Dr. Maidha Jadoon. And Dr. Salma, can you introduce about Dr. Maidha Jadoon?
Yeah, sure. Dr. Maidha is part of a faculty of DME, and right now she's doing her master's in medical education from University of Lahore, and I think she'll get the degree in September, inshallah. She's a very dynamic lady, taking care of all the medical education issues, and they teach as well. My medical education department does take the prime classes, which is mandatory by the PMDC. So I give it to Maidha, and I know she'll be a very good academician, inshallah, in future. And it's a very interesting topic. So Maidha, take over the floor. All the best.
Over to you, Maidha.
Thank you, sir.
Dr. Maidha,
I'll just
you
correct one thing. It's Dr. Maidha.
oh, sorry,
Every time
Maidha,
Madam also
Maidha.
forgets it. It's
Maidha
Maidha
Jadoon.
Jadoon.
Yeah, Maidha
I
Jadoon.
actually call her Madho, so I don't know whether her name is
Yeah,
Maidha or
she
Maidha.
really calls me Madhu and she forgetted
Maidha,
that full
Maidha.
name is
उस सूरत
Maidha.
मायदा से मैदा है, मैदा, ठीक.
Ji, sir.
So can
And
you open your screen?
yes, sir.
We are
Sure.
not you and
Can everyone see
if
this?
your photo is not visible, can you open your picture and then start this one
Yes, sir.
before
Sure.
starting this? Okay.
Am I clear?
Yes, you are now clear. Yes, you start. Welcome, beta.
Thank you, sir.
Can you go on PowerPoint presentation? This and then. It's
Are
okay.
you able to see my PowerPoint?
Yes.
Okay. So I'm recently doing masters in medical education from Khyber Medical University, Peshawar.
अच्छा खैबर में KPK.
Ji.
Sorry, it was
uh,
a master's from UL.
Sir, ma'am, that's Fatma who's doing from UL, University of Lahore. I'm doing it from Khyber Medical University. Okay, so I hope that some of the people here, they may be knowing that what is a small group teaching. Can anyone tell me a little bit of idea of it? What is a small group teaching?
Yes, when there is a small group, 8 to 10%, or maximum 12%. So this generally we say
This is also called SGD.
G, sure. Correct, sir. Okay. So by the end of my presentation, the whole group who's joining me, they will be able to describe the small group teaching. They'll be able to discuss the advantages and disadvantages of small group teaching. They'll be able to discuss different types of small group teaching strategies and differentiate between these small group strategies. So I have already asked you, and someone answered me that it is a small group of 8 to 10 members or 12 members. So let's see what is a small group teaching. So basically,
maybe 15 up to.
yes, sir, it can be up to 15. So basically, small group is about a small group of students who are regularly meeting under the guidance of an instructor. So let's see how many people does it take a small group to make a small group. So there are up to 30 people. You can make a group up to 30 people. In medical schools, we are running a small group. So there are 25 people in our 25 students that regularly go to a small group. So can you please let me know what you guys think about the difference between large group format and a small group format. What is the difference between them?
large group is generally taken as more than 30 or 50 students are. In some cases, we are seeing 200 and plus students are there in one.
Okay.
That
So mostly
is a purely lecturing generally. You cannot interact.
So, sir, basically, what we say that it's all about the interactive study in a large group and in a small group. So, large group, you always see that it is a teacher-centered approach. The teacher has all the control of the class. Sometimes it is not interactive. The teacher is just teaching, and she or he doesn't know that the students are learning or not. And for the backbenchers, mostly the teachers say that they are not learning or they are not listening. So in small group, this is basically a learner center approach. You can say the students have the control of this group. It is an interactive learning because student is taking the control of the whole topic. And
there is no
learners
teacher.
Sorry, sir.
And there is no teacher.
Sir, there is. We are going to discuss it later on. Dr. Amir, I am just going to move ahead and we'll see what is the basic difference between these two strategies. So in a small group, basically you give the stage to the students. So they are responsible to solve a problem. So they are quite active in it. In large group, there is a teacher who is responsible to teach the students. So let's see what are the advantages of a small group teaching strategies for everyone, for the teachers, for the students, and for the administration. For the students, I'll again say there will be an active learning, active listening, and they are going to present new ideas. It will be an interactive session. The team will collaborate and they will work together to find out the solution to the problems, and they will monitor their own learning. on the behalf of the teacher, what are the advantages that they can get the students a better know-how of the students. They will have an idea, because if there is a 25 people group and if there is a 100 people group, it will be very difficult for the teacher to interact with 100 people rather than 25. So there is a small group, they have a better understanding of what their students are getting and what they have the knowledge about. And administration, on the behalf of the administration, there will be an improved results.
I think mic of the somebody is open, and please mute it. Creating a problem. Adam Saab. Okay, I have, okay. Okay, you started. Maidha,
Okay,
you
sir. Okay, sir. So
I have muted myself. Okay.
Okay, let's see what are the benefits of a small group. Again, it will be an active learning, encourage self-motivation, it will promote the deep learning, and you will develop the skills, transferable skills such as teamwork, communication skills, time management, leadership, organizational characters in the students. So what are the disadvantages? Obviously everything has some merits and demerits in their characteristics. So the disadvantages are that when the stage is for the students, there will be more questions, and that can stray off the plan, because every time you cannot keep the students on track. So it will be little tough for the facilitator. So teachers, the quality assurance obviously will be difficult for the teachers, because all the groups are covering the same level. So checking this thing will be difficult for the teacher. Administration will need more resources. I'll talk about problem-based learning. Implementation of problem-based learning is little difficult, because you need more rooms, you need more teachers. So for administration, the management will be little bit difficult. So let's start with the ground rules. Before you start a small group teaching, all you need to do is you start with a ground rules. You need to set some ground rules. These are certain examples. You can have your own according to your own environment. See, if I'll start a small group, maybe I give them a start and finish time for the task. That is, this is your task. You can start at 9. You have to finish at 11. You need to you can ask the students to come prepared with the thing. Don't interrupt the participants. Treat others' contributions with respect. This is for the students, that they need to respect their other fellows' opinions. Maintain the confidentiality of the group and share with the whole group, not with your tutor only. Say when you understand it. So these are certain examples. In these, maybe some of these you don't need, but these are certain examples, that these are the ground rules you can set before you start a small group teaching. So things that need to be considered before the session and preparing the session. A small group teaching can never be pursued without a practice. If you have not shared the content, you have not shared the area where you are going to conduct a small group prior to the contact with the students, there will be hassle. Your time will be wasted. So you need to prepare your aims, the expected outcomes, the activities that you are going to give to your students in the class, in that small group, the resources, any contingency plan. If your skills lab is not available, what is the plan B for the area where you are going to conduct that small group? So you need to prepare a small group. So running a small group. So before running a small group, I have already defined that you need to define your objectives. You should tell the ground rules to your students. And an icebreaker, an introduction to that topic, it is a mandatory thing. You should give a small uh, content about that thing, a pre-class material that is known as. So in the middle of the small group, there should be a mix of your factual information with the points of interest. And there should be a logical progression from one point to another. After the session, you should revisit the objectives that you have achieved all. Answer and questions should be the part of your small group by the end of the session. So you should know that what they have learned from your small group. Ensure the follow-up activities. You can give them any assignment at the end, and there should be a feedback about every group, every team. What regarding small group teaching, what do you think, what this picture says?
So it can be on both sides. Means I can say a small fish jump into a bigger pool, or a big fish jump into a smaller pool, something like that. A big fish is already there actually. So yeah, small fish can go to its smaller group, and bigger fish can go into a bigger pool. So means smaller people can interact in more collaborative way, means their personalized attention, active participation, peer learning, or flexibility of learning. All these can be more precise and accurate. Rather than in group, all these is not possible. In a larger group, it is not possible.
Sorry, wait. Okay, sir, so this picture is about basically the role of the teacher. That the role of the teacher is very small in a small group interactive teaching. And students, they have a very big role. So yeah, the student is able to collaborate, and they are there to do big things that we don't expect from students mostly. So roles of the facilitator, I think Dr. Amir asked me about the role of the facilitator before this. So let's see what are the roles of the facilitator, of a tutor, right? So they are there to keep the group on the track. We are going to talk later that what I mean by this group. Helps participant to prepare and contribute. He or she is there that all the group participants, they should participate in this thing. They use open-ended questions, summarize the discussion from time to time, paraphrase or repeat to encourage input, and encourages collaborations, helps quieter members to come forward. So these are all the roles of the facilitator, that he need to keep the students on the track. He should summarize the discussion time to time. There should be an open-ended questions so that the students may think widely about the things. They should encourage the collaboration between the students and should help the quieter members to come forward. So these are the roles of the facilitator in a small group interactive teaching. So let's move on to the major chunk of the whole lecture, that what are the methods that are used for a small group interactive teaching. So these are the methods. That is a tutorial, seminar, snowballing, free group discussion, problem-based learning, case-based learning, team-based learning, and task-based learning. So I hope that you must have known the names, and there must be a little bit of knowledge of these things, as these things are on the boom right now these days. So let's jump into the discussions. So a tutorial is something that is basically a small group and a topic is already discussed in a class, and now the teacher can assign certain questions to the students and can ask to read specific things, like will be a small thing that is related to a previously covered thing that is already covered in the lecture, and now you are just assuring that your students knows the things. So a seminar, it is basically that is assigned task at the beginning, and the students prepare the material in a given time, and one group is there that presents the topic and teacher just probes into students understanding. Again, it is a simple one, that the students come prepared and there is one group that is going to present, and the teacher is just going to ask the questions again. So again, here it is a smaller thing. So snowballing, I hope that you all must know what is snowballing. It is a research, in research, this is almost discussed every time. So you divide the students into pairs, and then each pair, they come together and they discuss, they compare and contrast their learning, that what the other group know. And in this way, the whole class, they combine, and there is this finalized deliberation in the plenary session. So in the end, the whole class just join, as you can see in this picture as well, that there were a pair, and then this pair, the two pairs, they combined. And in this way, the whole group combines and they discuss and they learn from each other. So a free discussion group, in this, the teacher introduces the material. Once the teacher has introduced the material, the teacher can facilitate by asking relevant questions. So these four, the tutorial, seminar, snowballing, and free discussion group, these were the simplest small group interactive teaching methods that you can use in your institutes. So let's come to problem-based learning. So anyone here knows what is a problem-based learning?
Assalamu alaikum, madam. Problem-based learning means that we will ask the students quite before the day of the PBL discussion, only the problem we will give, and they will search about the anatomy and physiology, biochemistry if they need. And then on a specific day, we will discuss their problem as a whole. We will not mention any investigations or some other X-ray or ECG. Suppose if we ask the students to search the problem of myocardial infarction, that is enough, I think. Am I right?
Great,
or not?
sir. Great.
Excellent.
Okay. You are, sir. To some extent, you are. Let's see. Let's see now that what does the slides say. So thank you, Dr. Gul. Thank you. Okay, ji, problem-based learning. So it is a teaching method in which basically there are carefully constructed clinical problems. They are presented to the students, as Dr. Gul already said that. So what happens that it is a small group of 10 to 12 students. And you know what you do? That every student has their own rule. Let's see what are the rules of the students. Their own roles, sorry. So let's see what are their own roles. So every problem-based learning group, it must have a scribe, a tutor, a chair, and a group member. So these are the certain functions that you can read by your own, but I'll just tell you the first thing, that scribe is the one who is just going to write down the everything that a group is discussing. A tutor, from that group of students, you choose a tutor as well that will encourage all the group members, and it has a thing that he will assist the chair and he'll have a check on the scribe as well, as he's a tutor. So there will be a chair of the group. From the students, you will choose the chair. The chair is the one who is going to lead the group and encourage the members to participate. And then there are group members who are there to participate in the discussion, and they are going to work on open questions. They are going to ask the things. So these are the members. So there, the three main things, and three main ones are the scribe, tutor, and the chair. And then there are the group members. So can you see what is can you describe anyone के कौन से इधर हैं हमारे पास, scribe कौन है, tutor कौन है, members कौन है? Okay, let's move ahead. So there are basically, in a PBL tutorial process, there are 7 steps, and they are known as matrix 7 steps. So these are the 7 steps of the matrix. First thing is, whenever you provide problem to your students, what they do, they just list the things that are difficult, then they define those things, those problems. The first step is they are just going to write down the difficult things. They will list up the terms that are not familiar to them. The second step is they are going to define the problems and they will discuss these problems. The third is brainstorming session to discuss the problems. The fourth is they are again going to review the second and third step to define the problem and brainstorm again. Then they are going to formulate their learning objectives. See, the learning objectives, they are formulated by the group of the students and the teacher who is from the college side, he or she, they didn't provided any learning objectives for this problem to the students. So students formulate their own learning objectives after the group's consensus. So after these 5 steps, these are the part of the first session of the PBL. After this PBL, first 5 steps, there is this private study that every member of the group is now going to study by their own as they have formulated their learning objectives. So now these learning objectives, they will be achieved by the group and they are going to have a private study in the 6th step. After the 6th step, this is the second session of the PBL. The first session that was at the start of the week, that will have only 1 to 5 steps of 7 steps of mastery. After that, there will be a private study, and then there will be a step 7 that is known as group shares the result of the private study, and tutor is now going to check the learning and going to assess the group. So I hope this is clear. So let's see how you adjust this PBL in your timetable. So in your timetable, you can see that on Monday, there is PBL session 1. You can mention your room, that which room this session is going to be held. And then there is the second session is on the Friday. So this is the second session of the PBL. So let's see, there is this example that this is a problem basically created, and there are these 2 triggers of this problem that you can give to your students. Now is a little bit different thing. Creating a PBL guide, it involves the whole departments, because a PBL session that you are going to adjust here, it will not be the part of whole this theme. In this theme, you are not going to give the topic that you are, see, this trigger is about lactic acidosis. So this is not touched in that theme by anyone, not by anatomy department, not by biochemistry department, not by the physiology department. So these departments, they are going to construct this guide for the students, and this guide will be given to the students on the PBL, before the PBL day, on the PBL session 1. Okay? And at that time, they are going to see this problem. So you cannot adjust this topic in your theme. So that's why for this purpose, you need the collaboration of the departments. So again, these steps of mastery, that 1 to 5, they are the part of the first session of the PBL, and the 7th step is the part of the second session. So at the second session, when you are going to close the case closure session, that is known as, what is the role of the teacher here? He or she is going to provide the feedback. I will again say, small group teaching, feedback is a very important, and you will evaluate, the students can evaluate the teacher, and you are going to discuss the learning issues identified in the last session. That is it. So this was PBL. So let's see what advantages can PBL give to students. So they will be able to have a teamwork, the chairing a group, listening, recording, cooperation, respect for colleagues, critical evaluation of the literature, self-directed learning, use of different resources, and presentational skills. So these are certain generic skills and attitudes that the students will develop after a PBL. So case-based learning, this is the second important one. So let's see what is a case-based learning.
PBL.
Sorry.
Okay, continue, beta.
Okay. So in a case-based learning, what happens that a case is basically provided again to a group of students. So the difference of the case-based learning is there you provided in problem-based learning, you never provide the learning objectives. However, in case-based learning, you give them a proper case that whose learning objectives are predefined by the teachers, that these are your learning objectives and you have to you have to achieve these learning objectives. They are already given by the teacher. So the case, it can be anything. It can be a paper based case, it can be a clinical laboratory data, it can be photograph, videos, newspaper articles, it can be anything that is related to your topic. So summarizing the case-based learning, again, you will set the ground rules, you will give the learning objectives to your students, you will present the case and discuss after the students identified and solve the case. So this is how it is a different one. The major thing is in case-based learning, it is a guided inquiry. I told you that the teacher, they share their learning objectives with the students. However, in problem-based learning, it is an open inquiry. You don't give the learning objectives. You just provide the problem to the students. So let's go ahead. Okay, see, in case-based, there is this one session. In this session, it can 2-hour session, and what you have to do, you have to close the session in this 2 hours.
उल्टा करके
Team-based learning. Acha, team-based learning, it is something that can be used as an alternative to your large group format. So you can use team-based learning in a group of 100 students. So let's see how team-based learning is conducted. So it has 3 phases. It has a pre-class phase, then it is an in-class phase, and then there is a in and during class, they have the same things. So let's see what is before the class. What you do, you provide the material to your students. That is known as preparatory phase. And what you do, you give the task before, you give that problem before the class. During the class, during the class, there is this thing that the students, they need to come prepared with the problem, right? जो भी आपका task उन्हें दे दिया, they have to come prepared with it. And what do you do that in readiness, there is this readiness assurance in the class, that is your class ready? So what you do, that there is this IRAT, it is known as individual readiness assurance test. This IRAT is basically individual readiness assurance test. What you do, that the classes came prepared with the material. Now you take their individual readiness assurance test. After this readiness assurance test, it will tell the teacher that the class is ready. What you do, you divide the class into different groups and you take the TRAT, that is a team readiness assurance test. For the team readiness assurance test, what you can do, see, these tests can be an MCQ, it can be that topic that you have given to your students before coming to the class. This test is related to that topic. So it can be anything. They can be extended matching questions, they can be MCQs, they can be fill in the blanks. So जब आपने वो same test जो आपने individually दिया था, you give that same test as a TRAT. You make a group of 7 to 8 people and you give that test to a group, and you see now how the group is going to collaborate and how their percentage will be. So this TRAT, this is a thing that they just make the team-based learning interesting by using this. They say to create this immediate feedback assessment technique. This is a small card. ये जो कार्ड है आपकी यूज करते हैं इन अ TRAT, टीम रेडीनेस एश्योरेंस टेस्ट में आप इसको यूज करते हैं. एंड व्हाट द स्टूडेंट्स डू, for example, that you have given them a multiple choice question, right? And it has an option A, B, C, D. the students, they scratch this card and you will see, they will see if there is this star, that means they got a correct option. So they can score according to your marks, jo bhi marks aapne unhe diye, and they can score it according to that. But in the second question, what happens? The team was not ready for this question and there was no star. The answer got wrong. And what now they do? They will again take a second chance after reviewing that material, and they will take a second chance and see that if there is a star, are their understanding of this question is right now or not. So this immediate feedback assessment technique card is basically made for TRAT to make it interesting for the class. And then there will be a team appeal. A team appeal is something that they will talk to each other. The teams, they are going to discuss that how the answer was right. Team A, let's suppose I'm just naming them as team A and team B. So team B can answer that question. They can question that what is the team A understanding of question 1 or 2. So in this way, so these are the tests that are taken in the readiness assurance in phase 2. And after that, there is phase 3, in which the teacher in the class, teacher takes the stage, and he or she, he give the feedback, and there can be a mini group lecture or small group assignment, anything that teacher thinks. So team-based learning is basically divided into three phases. So first phase is your pre-class phase, in which you give the task to the individual. They come prepared to the class. In the class, you take these readiness assurance tests that are individual, and then TRAT. And then there is this team appeal. After that, there is a mini lecture. So I hope this is just a percentage that was given by one of the studies. So I just mentioned it here. See, in this, there is this peer evaluation is one thing as well. That this thing is like, कि जब एक टीम में काम चल रहा था, तो they evaluated their fellow, that how much he or she was cooperative, or how much he or she was prepared in this. So peer evaluation was also added in this percentage grades. So let's move to the task based. So we are done with almost 7, I think so. So task based learning. In task based learning, this is basically a task. You give a proper task to your students, or anyone with whom you are doing a task based learning. You give them a proper task. For example, let's take a module, blood module. In a blood module, if there is a team hypertension, so you can give a task based learning session on measuring the blood pressure of the patient. So this is a proper task in which the students can perform that task. And you can, again, there are these 3 phases of task based learning. So these phases are a pre-task phase, then a task introduction, and task performance. Again, you are just going to select a task from your curriculum, as I selected blood pressure from the blood module. And then I'm just going to introduce the task to my students and highlight the words and phrases that are important. For example, a hypertension patient must have these readings, and what readings are normal for them. So help the students to understand the task and explain the instructions. So task performance, now the teacher is there to monitor the task. So these are the differences between case-based learning, problem-based learning, team-based, and task-based learning. So I hope the session was helpful to everyone. So if there are any questions, you are open to ask them, please.
Thank you so much. Before I think I start the question answer session, I will request anybody want to comment on this lecture. Excellent lecture, Dr. Maidha. And now we are very careful for your name.
Welcome, sir. Dr. Khalid.
Yes, Dr. Khalid. Yes.
A very focused and comprehensive effort, considering that she's quite young and she has done a great job. She has overviewed all the aspects in a very, very focused, I would say, and in a manner so that everyone can understand what are the pros and limitations of these all these modalities. Bravo, great.
Yes, sir. So she has not only described things, she has compared different groups and advantages and disadvantages. I think it is good to understand and keeping in mind the advantages and disadvantages. Dr. Maida, it was a really good lecture.
Thank you so much, sir. Thank you so much.
Assalamualaikum, sir.
Salman.
Dr. Naveed from Bahawalpur, Quaid-e-Azam Medical College.
Oh, you are
Very
always
good. Thank you, sir.
Yes.
Very good lecture, sir. Zabardast. Really
Biochemistry,
enjoyed.
Department of Biochemistry, Professor
Yes,
Naveed,
sir. Yes, sir.
Department of
Yes, sir.
Biochemistry.
Yes, sir. Yes, sir. Recently, I have completed certificate in medical education, so I really enjoyed.
Yes.
I
Thank you,
have
Dr. Naveed. Thank you so much,
Good.
sir.
good,
Dr.
Dr.
Salman, you want to ask the question, Dr. Salman?
No, it's not a question. It's just a statement.
Madam Salma Kundi.
Madhu, I only wanted to know we have a very rich faculty, mashallah, our Department of Medical
Mashallah.
Education, headed by Dr. Abdullah, who's done PhD.
Really, from the last 3-4 webinars, we are also looking that you have a very richest knowledge
Alhamdulillah.
faculty.
My point is, I want to know, Maidha, that you
Ji,
know
ma'am.
everything, and I'm sure you all give seminars and you teach the faculty. But how do you implement it? Do other people know? For instance, let me talk about physiology. Do the demonstrators and the lecturers know how to go around their job, how to do the small group discussion, and whether
Yes,
they
ma'am.
give you
Ma'am,
feedback?
recently when
I'm talking of
ma'am,
implementation.
yes, ma'am. Recently when we conducted this seminar, yes, ma'am. Ma'am, basically, recently we just know that the task-based learning is being conducted in physiology and anatomy departments. And about problem-based learning, I'll again say that Dr. Abdullah and we are working hard on this thing to achieve that thing, because we need the faculty to make these guides, because a problem-based learning is a thing you need guides for both teacher and the student, so that it can be conducted by anyone from any department. So about problem-based learning and case-based learning, I will say case-based learning is basically conducted in final years. The final year faculty told us that they are provided with the cases and they are giving them the learning objectives. So about problem-based learning, it is hard to achieve it right now, but we are working on that. However, case-based learning and the task-based learning, they are being done by the final years and the basic sciences right now in our institute.
Dr. Rashid, Dr. Rashid, you are welcome. Dr. Rashid, Professor Rashid, yes, unmute and ask the question.
Assalamu alaikum, sir. I'm Dr. Gul Muhammad, assistant to Rashid Mahmood Saab in Rahman Medical College, Peshawar.
Yes.
Sir, I want to clear my mind that how much time before the small group discussion we can share the contents with the students? 24 hours or just finishing the topics in the large group discussion?
Okay, sir. Sir, thank you for your question. First, okay, basically, it depends upon your material. If you think that the students can cover it in 24 hours, your learning objectives can be covered in 24 hours, you can give them this thing 24 hours. What mostly in our sessions, what we do, we give them this thing let's talk about PBL. PBL, I'll talk about PBL. You give the learning objectives. I already told you that the PBL session, never discuss that before the session. So you give your guide to the students in the session. For a team-based learning, your students might come prepared for a test. So you should give them a week ago, because there is a test in team-based learning in your session. They should come prepared for that test. For again, task-based learning, you are going to give them the task. So if you think that this task, blood pressure can be checked at the same spot. So I feel like for blood pressure, I would not give them any beforehand preparation. But for case-based, again, a week ago, 3 days ago, because 24 hours, as we are familiar with the topic, we cannot say our understanding and the students' understanding is at the same level. So all you need to do is a 3 day ahead or a 2 day ahead session is much better, far better for them.
That depends upon your learning objective and your material. Yes. Anybody else? If there is no question, Professor Rafiq Kanani Sahab, you are the senior teacher, and Professor Umar Ali Khan. Can you comment? Professor Umar Ali Khan.
Assalamu alaikum.
Yes, Professor Rafiq Kanani Sahab.
Dr. Maidha, thank you very much for your very nice presentation. And you made certain concepts very clear. I also feel the same way that, of course, a small group teaching is much better. The only problem that all of us in the senior faculty are facing is shortage of the trained teachers. That's making us our task much difficult.
Yes, sir. The resources are basically.
Professor Umar Ali Khan, can you comment few things about Professor Umar Ali Khan?
Sir, I'm online. Thank you very much. It was a wonderful lecture. But my request is that we should not be, as I always say, we should not become slaves of the teaching methodology. Our main objective should be very clear that we want to make physicians who are helpful to the patients.
I think
medical education thing that you can fit for all cohorts, because the entry test is designed in the world to judge the cohort, that what type of people I'm going to get and what type of methodology I have to use. And then it has to be reviewed. You cannot start, doing this methodology unless reviewing it on modular basis, every module, then you have to review and change your strategies. Only then you can, and then you have to see that how much understanding is produced. How much they have learned doesn't matter. I hope you remember one joke, the lighter side, कि एक बच्चे ने आके कहा कि अब्बा मैंने कुत्ते को सीटी बजानी सिखा दी है. तो बाप ने कहा अच्छा वंडरफुल, यू हैव डन गुड जॉब. वो गया, उसने कहा कुत्ते से कहा सीटी बजाओ. तो सीटी कुत्ता कैसे बजा सकता था? उसने कहा अब्बा मैंने कहा था कि मैंने बजानी सिखा दी है, ये नहीं कहा था ऐसे आ गई है. So this is the basic thing that we must learn. The people, the student, our colleagues, they should understand what we are saying. And then this is a professional life. Then they should know how to implement it. This is the crust of the matter. If I know everything but I cannot implement, so these are my few 2 cents, please. Thank you.
And excellent comments. I think as a senior teacher, I agree with Professor Umar that our objective is only to prepare the good teacher, good physicians, good clinicians that may be helpful for the coming generation of the students and of the community. Professor Salma Kundi, over to you because time is.
Dr. Yusuf Saab is here. He is our senior most faculty teacher. Yusuf Saab, please give a comment.
Dr. Yusuf Saab, can you?
Great physiologist and a great teacher. As a faculty member, I used to go and sit in his class to listen to him because it's like magic.
Professor,
Yusuf Saab?
If you can unmute and give your comments about small base learning, small group learning.
I don't know.
Okay, madam.
Okay, anyway.
Conclude
I
today's
take
session.
this opportunity of thanking everybody who is present over here and thanking Dr. Maidha for the lovely piece of talk over here. But I agree with Professor Umar Saab and with you, Professor Mulazim Saab, the basic thing is implementation. That's why even before my vote of thanks, I asked Dr. Maidha about how they're implementing it. Although we are in the same college, and I know they're holding seminars and webinars and taking group discussions, etc., with the faculty members. But even then, there should be a proper protocol of how the implementation is going around and what the feedback is. And I hope my DME works on it and gives us good results and a sound feedback. I thank everybody who's come today, over here today. Allah bless you. Have a great weekend. Pakistan Zindabad.
Dr.
Thank
Maidha,
you.
there are so many thanks on the chat box, and we are also thankful for the
Thank you.
Akhtar Mahmood and from Amjad Ali Khan and for other Masuma and for Abdullah Qazi for your input for the today's session. Hopefully, inshallah, we'll see you next time. And next time, my fourth year students will present the webinar, and that webinar will be, inshallah, very beautiful. Thank you so much. Thank you so much. Allah Hafiz. Allah
Allah
Hafiz.
Hafiz. Allah Hafiz.